Hello everyone, my name is Nadine. I'm a house officer at Al Qasr Al Aini Hospital in Cairo, Egypt. It's an honor to be here with you today. I'll be talking about a case report of spleen wandering and torsion following Nissen fundoplication of a 17 years old female patient that presented to the emergency department with severe left hypochondriac pain for about 7 days duration, with a progressive course of about 4 months. There were a surgical history of appendectomy 4 years ago, an exploratory laparotomy for intestinal obstruction 7 months ago, and a laparoscopic Nissen fundoplication 5 months prior to the incident. The patient was vitally stable except for tachycardia with free medical history. Labs were ordered with normal value readings, and CT scan of the abdomen was also performed and showed enlarged malrotated spleen as shown in Figure 1, which guided us to the diagnosis of splenic torsion. Thus, exploratory laparotomy was performed for splenectomy as it's showing in Figure 2, and during that, it was observed that all of the short gastric vessels had been divided, which was the cause of the splenic torsion. Patient was discharged after a proper post-operative period without any incidents. And this led us now to the discussion where splenic torsion is a rare condition that it has an incidence rate of less than 0.2%, as the spleen, normally supported by the laxity of the short gastric vessels and the ligaments. But in Nissen fundoplication, which has become popular these days as a surgical treatment to guard the multifactorial worldwide disease, as well as the bariatric surgeries as sleeve gastrectomy, as in these procedures, we tend to divide these short gastric vessels in order to improve the complication of these surgeries. However, this wasn't agreed on by a previous literature and another systematic review, where they see that dividing these vessels has no benefit at both short or long-term follow-up. And to conclude, further studies are needed to demonstrate the risk-benefit ratio of dividing the short gastric vessels in laparoscopic Nissen fundoplication and bariatric sleeve gastrectomy. Proper electronic records must be maintained for each patient, including patient's history, lab diagnosis, indication for these surgeries, where it would be accessible for every physician to avoid lost records and reduce medical errors. And it is advised to educate patients about the possibility of splenic torsion following these procedures, even if the risk was minimal, and to report any left hypochondrial pain post-procedures. Feel free to scan the barcode to access to the full references site. Thank you for listening.